people have in workplaces, right? So mental illness is really common. It's the most common, obviously alcoholism as well, but diabetes, heart disease, and so forth. So it's very hard to expect workplaces to be, I think, too deeply educated, however much one might want that. I do think that having more available online for people to learn from, is really helpful, to just learn about, A, how common it is, B, how costly it is if you're an employer, not to treat it, and how much people suffer, and what can you do about it? I think people need to learn more than they do, and the question is how do they do that? I mean, one of the programs, for example, the school system, one of my colleagues at Johns Hopkins, Dr. Karen Schwartz, has been very interested in the aspect of stigma that keeps kids from learning about depression and getting into treatment. So she started off in both public and private schools in Baltimore, going in and just doing, reaching out to not just the teachers and the students, but also to the parents, and having them all come in and just learn about depression, not any big, complicated deal, but just learn these are the symptoms. It's a medical illness, it's treatable, having some short clips of kids talking about their bipolar illness and their depression. And that is now a national program and even international as well. And she's done it all so that's online and available to school systems and so forth. I think that trying to do that in the business world, I'm more familiar with, I guess, public health and with the school systems. But I don't know why that couldn't be done. It's just that in all instances, there's a tremendous call on people's time. So I don't think you can keep asking teachers, for example, to learn one more thing or to reach out and be counselors or reach out to every troubled kid. It's completely unreasonable, and they've got to be teaching kids. So I think the more that you can bring into from outside that is good quality stuff, not just some sort of, you treat it with ginger and crystals and, whatever, but serious treatment and serious thing. I think people know more now than they used to. I think the universities are better informed, but they're just very few resources. And I think business is hit in the same way that everybody else is.